Can we go ahead and hear, please, Deputy Catherine Connolly?
And Ministers, you'll excuse me if I leave out the thank yous. We're dealing with a pandemic where almost 250,000 cases we have, and the up-to-date figures on death are 4,856. I've always said that vaccination is part of an overall programme, and I stand here week after week in utter frustration that there's no overall discussion. I don't blame you for that, Minister. It should be led from the Taoiseach, an overall discussion where we are in this. In relation to yourself, Minister, very specific question, the call centre. More than 4 weeks ago, you put it as part of your speech to sort out the communication difficulties. You established a call centre. I don't wish to waste my time now, but if you could answer me, please, in one sentence, where is it? What does it cost? Why haven't I got an answer 4 weeks later? Thank you.
Mr.
Call centre, we're referring to the call centre for the GPs, Deputy, or the HSE
no,
Live
I'm not going to go through this. I'll tell you why. 4 weeks ago, you included it in your speech. When you had finished your speech and when I eventually got my turn, I asked you about that call centre. You said you'd come back to me with the details. I emailed your office. They came back with some, they would tell us, they didn't. Then they came back, which call centre? And we came back and said the call centre that the Minister referred to in his speech. So I'm going to park it now unless you can answer me, because I'm not talking down the clock. You referred to a call centre as part of the solution to the communication difficulties, and you were to give me all of the details. I haven't got them. Can you commit today to giving me all of the details?
Thank you, Deputy, and you most certainly should have got them if I committed to them. The only question I'm trying to clarify is there are two call centres. There's one for the GPs
I'll have all the details.
And there's one for the public.
No, thank you. It's not a question of how much knowledge I know or you know. It's a question of you including it in your speech 4 weeks ago. And now I know nothing about that because I'm still waiting. So please give me a commitment today that you'll do that, and I will be happy with that. But mind you, I got a commitment twice already with no result. It is important because at that point there was huge consternation amongst the GPs in relation to communication difficulties and the rollout of the vaccine and vaccination programme. And you said this is part of the solution. I'd like to know the details of that. In relation to Minister Butler, thank you very much for your speech, again, both of you for your speech. Just in relation to the ambulance programme, is the National Ambulance Programme working from Dublin, going out, or are they based locally? Just operationally, how is that managed in relation to the vaccines?
Butler?
Thank you, Deputy. They're based in the various CHOs. They're not just coming out from Dublin.
Lovely, Garmargaret. And just while you're on your feet, just in relation to respite, and I know your heart is in the right place, but over a year later, all the families have no respite. They're going to go under. Surely it's not beyond the ability of the health executive or who the appropriate organisation on the ground to restore safe respite services.
Respite is actually available in certain cases. It's not completely stopped. I know, for example, I dealt with a case in Galway last week in relation to respite, and there was another case I dealt with personally in Waterford. The person had to have home adaptations and got respite for 2 weeks. So it is still available, okay, but on a case-by-case basis. But
okay,
if you want to come back to me,
I don't like doing a case-by-case because I know ministers are very busy. But now I'm going to have to come back because we've just got no on the ground. Okay. And in relation to that. Then in relation to temporary accommodation for healthcare workers, if Minister Donnelly could answer that. Again, very briefly, why has this debacle arose where 2 healthcare workers were sent home? I've tried, before raising it on the Dáil floor, I always try with Dáil questions first, and I'm told in a reply that that temporary accommodation scheme has not been stopped. And yet the interpretation of it allowed for 2 workers to be sent home. Can you add to that or clarify it for me?
Mr. Donnelly.
Apologies, Deputy. I'm genuinely trying to be helpful. I'll need more details on the specific case. And can I say, if you haven't been getting the detail in writing from me through parliamentary questions or indeed through our debate here, you should be, and it's something that I will take back today.
No, that wasn't my question. I'd moved on from that. This is an issue that arose that's been in the RT news in various papers about 2 healthcare workers being sent back to direct provision centres, as it happens, but because the temporary accommodation wasn't available. Now, I've gone to the trouble of tabling questions in relation to this, and I'm told the temporary accommodation is up and running, and yet it's been interpreted as if only if there's a cluster or an outbreak will they get temporary accommodation. So I leave that with you because I want to make just a few general comments in relation to vaccination. I think it's absolutely appalling and unacceptable, the comments by the Taoiseach that people would go to the bottom of the list. I think it's an insidious interference with the doctor-patient relationship, the manner in which the programme for 60s to 69s have been rolled out, to go onto a portal. And regardless of their medical history, I can't tell you how many calls I've had from people, different medical backgrounds, cancer being one of them, and previous clots. And they were told to go on a portal, take what they got or go back to the bottom of the list. Now, you didn't say that, Minister, but that's the message coming from government. It is totally shocking and unacceptable. So if you could take that message back, I'd appreciate that. In relation to the final issue is in relation to a compensation scheme. And you know, Justice or Judge Charles Meehan published a report earlier this year, the end of last year, December, in relation to alternative mechanisms for medical negligence. Part of that was in relation to vaccinations. What progress, if any, has been made? What discussion, if any, has been in relation to these vaccines, which are very much in a trial mode given the pandemic? What's going to happen in relation to a no-fault liability scheme? And what estimate has been done of the indemnity given to, I don't know, many pharmaceutical companies at this stage in relation to the liability for the state in relation to that? Now, there are only a few seconds left, Minister, so I'm simply raising it once again on the floor of the Dáil in the hope that in due course it will come up for discussion here, or if you can enlighten me in a reply in relation to the indemnity and the actions following the published report and now the implications for the current round of vaccinations.
Thank you, Deputy Connolly. We go to Deputy Joe